All right. Okay. Hi, everybody. My name is Lori Martinson. I'm the director of the Wright Rural Medical Scholars Program and want to share with you today how you can get involved in rural medicine as a student in Boonshoft School of Medicine. I'm joined by Jana Vossler, who's our rural health coordinator, and two of our fourth-year medical students, Carolyn Steerhoff and Katie Lomeo, who have done extensive rural experiences. So to start off, I'm going to give an overview of the rural program, and then we'll let Carolyn and Katie talk about their experiences, and you can ask any questions that you have. So you can see our mission here. We're all about workforce development. There's severe physician shortages in rural Ohio, and our job is to figure out what kind of programming can we develop at Boonshoft to try and address this shortage. So you're somewhat familiar with the curriculum, depending on where you are in medical school. Right now, I'm assuming most of you are in the foundations phase. What we're going to be talking about more is the doctoring phase and the advanced doctoring phase in years 3 and 4. So what I'm going to share first, this has nothing to do with rural. This is just how the third year works for every medical student. I think it helps to understand this before we get into how rural can be applied to this. So every medical student at Boonshoft, no matter what your interest is, does these clerkships. They do a family medicine experience, internal medicine, neuropsych. You can see them all listed there. They are all 8 weeks. Neuro and psych are each 4 weeks. Now, within some of these, they are broken down into sub-experiences, if you will. So if you look at pediatrics, pediatrics is an 8-week experience. 4 of them are inpatient, 4 of them are outpatient. Currently, all the inpatient is typically done at Dayton Children's Hospital, but outpatient can be anywhere. Surgery is another good example. 4 weeks are general surgery that can be done at a variety of places. 2 weeks are trauma, and they're almost always done at Miami Valley as a Trauma 1 center. And then there's 2 weeks of subspecialty that could be done at a rural site or an urban site. Compare this to family medicine, where you're almost always staying at the same site for 8 weeks. So to talk about rural a little bit, family medicine is a clerkship that's easily done at a rural site for the entire 8-week experience. Internal medicine is one we just started developing this year, but we have students doing the entire 8-week internal medicine at a rural site. Neuro and psych are a little bit tougher in rural sites. For neuro, we currently have 2 of the 4 weeks can be done rural, but then we have students come back to Dayton for 2 weeks because there's experiences like the coma patient that you're not going to see in a rural site that we want you to experience. We currently don't have any psych issues, experiences at rural sites, although we are working on that one. Pediatrics, the outpatient portion, we have a number of students doing that at rural sites. That's a great rural experience. Surgery, we have general surgery at rural sites. The trauma, like I said, is being done at Dayton, and we definitely have subspecialty experiences at rural sites for students that want that. Women's health, we have had in the past. We just don't have any preceptors right now, but that's one we think we're close to getting back on board. So it's a great rural experience. It's just a matter of having the preceptors available. So again, no matter what you want to study, what you want to go into, whether you're interested in or not interested in any of these topics, everyone does these clerkships. There's third year. So you're assigned, what a clerkship looks like is you're assigned to a preceptor or sometimes a couple preceptors because 8 weeks can get long. So the couple preceptors will share you. They are all board certified physicians in that specialty that you're experiencing. They could be MDs or DOs. You may also work with NPs and PAs, but they will not be your primary preceptor during your third year. You roughly assume the schedule of your preceptor. So if you have a preceptor that does, a family med preceptor that does nursing homes on Thursdays, you go to the nursing homes. If they do maybe Friday night high school football, they'll give you the opportunity to do that with them. If they're on call, you may go on call with them. So you go where your preceptor goes and assume his or her schedule. You dress, act, and speak like a professional. You're not just standing there shadowing off in the corner. You're engaged in this process. You will see patients alone, but the doctor will always come in. You'll never just see a patient, the patient would leave. The physician would always come in and also meet with the patient, but you might have first shot at them. And again, a little bit more, this is again, still general information that has nothing to do with rural. Every clerkship has something called didactics, where you're doing more hands-on learning. You get with your classmates that are also doing that clerkship at the time. It's typically a half day. A lot of them are Wednesday morning, but some are at different times of the week. And also in your third year, your entire class will get together on Wednesday afternoons and have an all-class didactic session. So those are times when you're not expected to be in clinic. You're in a mandatory didactic section. So for the rural students, this is where COVID has helped us a bunch. We've had to develop distance education. So for rural, before COVID, we were doing a lot of didactics at the rural site, but sometimes the students had to drive back to Dayton. Right now, everything's distance ed, and I'm hoping once COVID is no longer in our lives, we'll be able to keep those distance ed features so the students that are at rural sites wouldn't have to go back to Dayton hardly at all for their didactic sessions. And I should have added, if you have any questions, please feel free to write them and type them in the chat. So to help you with your geography a bit, Dayton, Wright State Dayton campus is down here at the bottom of this map. The Lake campus, which is where I work and is a regional campus of Wright State, is up here in Mercer County. So Wright State has one regional campus. It's in Salina, but we sit right on the Grand Lake St. Mary, so we call it the Lake campus. The H's are hospitals in our territory. We're not at every single one of these, but we're at most of these. So two of our key partners are right here by the Lake campus, Grand Lake Health System in St. Mary's and Mercer Health in Coldwater. Greenville is another prominent site, Wilson Health. So this is roughly our territory, although I'll tell you a little secret. We're going up here. There's a health system up north of this map that has heard me present at a conference and asked to start taking our students. So we're always looking to expand, and really all of rural Ohio is what we eventually want to get to be our service area. So students that are from Eastern Ohio and want to practice in a rural community there, we could help them set that up too. Okay, so now we're back to talking about the rural experience. It's really a spectrum. So we have students that do rural experiences. About 75% of them tell us, I want to have one clinical experience in a rural setting. So they're not necessarily thinking they're going to become a rural physician, but they're interested in the experience. They recognize rural is an underserved population and they want to experience that underserved group of patients and see what the unique challenges are to them. So then we usually have maybe 5 students in each class that are very interested in rural medicine. And they tell us, I want to have as many clinical experiences as I can in a rural setting. So keep me there as much as possible. And those students are doing our rural pathway. We'll talk about that. And then there's other students that are kind of in the middle. They say, I'm not really sure. I'm willing to try a couple experiences. And what typically happens is they have an experience or two in a rural setting, and then they tell us, I'll take any more that you have. So you can have as little as one experience. You can have as much as we possibly have, which is a good chunk of your third year. And you could be somewhere in the middle. We want to work with you to figure out what's the right experience for you. And I should have said this up front, rural is totally optional. It's just an alternative experience for students. And it is a competitive experience. We typically have more interest than we have spots available. So there is an application, but we'll talk about that. So for everyone, though, we have a student interest group called the Advocates for Rural Medicine. A little bit slow on that right now because of COVID, and we're not able to gather, although we're working on an activity right now. So anyone is welcome to participate with this group and just learn more about, again, the unique challenges and appeal of rural medicine. I sit on the admissions committee. We are making a committed effort in bringing more rural students into the medical school because they are the best opportunity, the best chance that will turn out rural physicians. Although I will say 75% of physicians that practice in rural areas did not grow up in a rural area. So they came from the suburbs or from the city. And one exciting development is we received a $750,000 grant from HRSA, just started September 1 to develop our first rural residency. So it will be a family medicine residency in Greenville, which is also one of our sites where students can go for their family medicine and their surgery clerkships. So we're again, always looking to grow and looking for new ways we can create opportunities for students who want to experience rural medicine. So the rural pathway, the tagline I use all the time is, this is for the students. We want to put them at rural sites early, often, and for extended periods of time. These are students who prefer to be in a rural setting. They're fairly certain they're going to become a rural physician, and that's where they want to get their training because that's where they want to practice. So again, approximately about 5 students a class. Sometimes it's a little bit more, sometimes it's a little bit less. Um, the people doing the pathway usually want to become a rural physician, and the expectations are minimal. I will tell you, it's usually not what they have to do, but they go in the rural pathway because they want first dibs on everything new that gets developed. But the minimum requirements for students who go in the rural pathway, they do a family medicine. It's called the AHEC experience. It's with a family med physician in the summer between their first 2 years of med school. It's paid and it lasts for about 4 weeks. So it's a great early experience in clinical medicine. During their third year, the doctoring year, they have to do at least 1.5 clerkships at a rural site. So I say a half because to go back to that pediatrics example where half is in Dayton inpatient and half can be outpatient, that outpatient meets the half requirement. We almost always expect the students to do family medicine rural if they're doing the rural pathway because we think that's the best way to experience rural medicine. And then in the fourth year, the advanced doctoring year, they have to do at least one elective in a rural community. We expect them to be involved with the student advocates for rural medicine, and they have to do their scholarly activity with a rural theme and or with a rural preceptor. So I will tell you, anyone that's interested in rural and doing the rural pathway, meeting these requirements is, they are way exceeding these requirements. And like I said, the big perk of doing the rural pathway is that these students get first dibs on anything new that is developed. And that's happening all the time. So as I mentioned earlier, we started internal medicine this year at one of our rural sites, and we just wanted to pilot it to work out the kinks. We had 3 students in the rural pathway. They all 3 jumped at the opportunity, so they're the first 3 that are being placed at this site. This will just kind of give you an idea, but again, it's always changing. So these are some of our main clinical partners and the experiences that you can do at those. So at Grand Lake and Mercer Health are closest to the Lake campus, and you would live at the Lake campus if you did experiences there. Greenville has its own housing, and there's an excellent FQHC. This is where we're doing the family med residency. So you can do family medicine at the FQHC, and you can do surgery at the hospital. Mercy St. Rita's is a larger health system and a little bit larger city. They have any number of opportunities, including a lot of great fourth-year electives. They also have their own housing, and they have a number of medical students from other schools. So it's an opportunity to train with other medical students as well as other health profession students. And then Wilson Health is in Sydney. This is probably the closest site. Sydney is only about 50 minutes from Dayton campus. They have family medicine, but we're working closely with them. I think that site's going to grow a lot in the next year. And then there's private practices that aren't part of a larger health system where students can do rotations. And we're interested, we've had students come to us and say, I'm from a certain part of the state where we're not doing our rural work, but they have connections with doctors and they could set up their own experiences. And we help them work through that process so they can maybe practice with physicians in their hometown. So if you have any interest in rural, but you're not exactly what we're talking about, come talk to us and let us know. We'd like to be able to help you in any way we can. We want to encourage rural medicine no matter where it happens. So first question is always, how does this affect my housing? The housing is provided for you at the rural sites free. It's furnished, the utilities are on, the Wi-Fi's on. You show up with your clothes and your toiletries at most places. Because you're coming for 4 weeks, 6 weeks, 8 weeks, or maybe for 6 months, 8 months, it's all the same. We have cleaning services that come in. They clean between each student. Some come in a couple times a month, even if the students aren't moving in and out. So that's all taken care of for you. If we fill up the housing, we do have a couple community members that have volunteered to house students, and we've done that with really good success in the past too. But we would always tell you if that's the option to make sure you're comfortable with it. Excuse me. So the students are going to tell you more their perspective of who they think is right for doing rural medicine, but this is my experience. When you go to a rural site, you are likely going to be the only medical student at that health system. So you need to be comfortable with the fact that you're alone. I think sometimes there's a misconception that if you go to rural, you can hide a little bit. You know, you're getting out of date, and then you might be able to just kind of be off to the side. But it's the exact opposite. In most cases, it's you and the preceptor one-on-one with the patients. So you go in the OR, and it's you and the surgeon and the surgical team. There's no residents. There's no other medical students. In most cases, they're not even nurse practitioner or PA students. So you need to be independent. Students that are self-starters really excel at rural. So you have this experience that we have plotted out for you, but you go to the rural site and maybe you meet a doctor in the lounge or in a hallway and you hear this great surgery this doctor's doing. The student that goes up to that doctor and says, hey, could I scrub in? I'm a Boonshoft student. I'm here doing this. They're the ones that really get the most out of the opportunity, seeing what's there and not being afraid to speak up and ask for more. You should be flexible and adaptable. You should be comfortable. Like I said, it's you and the doc, and so you need to be comfortable in that setting. For most students, that's the number one most appealing part of it. And then you need to be happy with the fact that you are going to be living in a rural community and not everything is going to be at your fingertips. In some of our sites, there is no Uber. The mall might be 30 miles away. Most of our sites have a Kroger. A lot of them have Kohl's. So these are not remote. This is not frontier medicine in Ohio like you might see out west, but it's rural. So if this all sounds great, this is what will happen in the near future. So for those of you in the class of 2023, we have already selected who's in the rural pathway. Those students applied last fall and started their first requirement already. They did their first requirement last summer. But we're still open to students that want to do single or maybe some more than one rotation in their M3 year. We will be presenting to you and presenting the application to you probably in December sometime. And then in January, February, we'll be looking at who's requested it, how many spots we have, and matching as many people as we possibly can. For the current M1 students, similar timeline. We will be reaching out to you again in December, more than likely, doing a presentation, doing the application. If you're interested in the rural pathway, this is the time to apply. If you're interested in maybe just 1 or 2 clerkships, I'm glad you're here getting this information, but you'll do more with us in your second year when we're getting ready for your third year. Again, everybody can be involved with the Advocates for Rural Medicine, though, also. One thing I should mention is you need to be in good academic standing to do rural. So any student that's struggling with their academics, if they have professionalism issues, if there's any reason that you're a little bit more at risk, we typically don't allow you to go rural because you need to be in Dayton where the resources, the tutoring, the faculty are available to work with you. So if you have any questions about that, feel free to follow up with me. This is Jane and I's contact information. We'd love to talk to you. Phone numbers are not the best way to contact us right now because we are working from home, but we're happy to set up a time to talk with you. So at this time, I think I'll turn it over to the students. So again, we have Carolyn Steerhoff and Katie Lomeo. And for starters, let's start with Carolyn. And why don't you talk about why you wanted to have a rural experience and what your experience was like? And I've kind of focused on how the rural experience is similar, whether it doesn't matter clinically whether you're rural or urban, you have to do the same things. Why don't you talk about what made the rural experience unique from your non-rural experiences?
Yeah, so hi everyone, my name's Carolyn. I originally wanted to get involved with rural health. I'm from a rural area like my hometown where I grew up, and wanted to pursue that as like a career as a physician. So I did several rural rotations, I think all that was available last year when we were doing it. So I ended up doing family medicine, pediatrics, general surgery, neurology. Sounds about right. Okay. And I really enjoyed my time at the Lake campus and in those rotations. I was never really particularly interested in surgery. That was something I was like against from the start, but I really enjoyed my surgical rotation and really got to do a lot more than a lot of my friends did that even like surgery down in Dayton. It was very hands-on. I learned to suture well. I took ownership of my patients that we saw in clinic like way earlier, like something I do kind of now in fourth year, but they gave me the independence, even in surgery, to kind of like get to know my patients and really like take ownership of the plan early on. And I feel that that really, really helped me for fourth year and, for the future. And I can't like stress enough how awesome it is to work like directly one-on-one with the physician, because you can ask like questions whenever you need it, and it's very collaborative. But I definitely agree, you can't hide. There are a lot of different things you can do in rural health in terms of like procedures you can jump on, patients you can go to see. My favorite part about like pediatrics was the nursery time. So in the mornings, we would go and see all the babies that were new in the nursery, and that was something not a lot of my friends got the experience to do in Dayton. We did a lot of circumcisions, as well as I think on my surgical rotation, even though I was on general surgery, I actually spent a lot of time hopping into like hysterectomies and other kind of procedures. And then on family, I spent time going to the nursing homes as well as seeing patients in the office. So there really is a lot of variety, and that I think was my favorite part about rural health.
Thanks, Carolyn. Katie, can you tell us about your experience, please?
Yeah, can you hear me okay? Okay, perfect. Hi, everyone. I'm Katie LeMayo. Let's see, I have nothing but great things to say about rural health, and I can echo lots of things that Carolyn was saying. I think I definitely agree with Carolyn that during your third year when you're rural, they definitely treat you more like a fourth year. And that comes with, like, that's good because then it pushes you sort of out of your comfort zone, but also comes with then, you know, you have to be at the top of your game a lot. But I think that's good. Another thing I was going to say of how it kind of compares to like when you are in your rotations in Dayton is when you're in your rotations in Dayton, you're mainly with the residents. So you basically see what your life is going to look like when you are a resident, if you know you want to do that specialty. And so going through rotations at a rural site, you're really able to see like what your day-to-day would be like if you were an attending in or like an actual position in that specialty. And I felt like that was really helpful for me when like trying to pick a specialty, because third year it's really hard when you don't actually see what the attendings are doing. You're just really seeing what the residents are doing, and residency, thank God, is not your whole life, right? It's only a few years. So I really thought that that was really valuable with rural health, that you're able to see actually what an attending would do in that specialty. Another thing is it's just really nice to be just you and the attending, especially in surgery, because it, like, just like Lori said, it is you and the doctor. Like, once the doctor is done and they hand you the thing to suture and you're like, oh, okay, no one else, it is me, all right, let's do this. So it's definitely it's good though. It definitely pushed me out of my comfort zone. I think I'm one of the people that, especially in Dayton, when there's a bunch of like the senior resident and the intern and like 5 other medical students that are also scrubbed in all around this thing, I'm definitely one that I'll just kind of sit in the back and just wait to do what I'm told. But like when I was rural, that like definitely didn't happen. It was like, nope, you're suturing, let's do this. Today you're learning, which actually is very valuable. It sounds scary, but it's not. They teach you how to do everything. And yeah, I don't know. The house is awesome. I can't say enough great things about like campus housing. It's so beautiful. Every day I would just sit out there like on a lounge chair and just look over the lake. It's so beautiful. And they also have really fun festivals. Obviously not right now because of COVID, but they did when I was there, and it was a good time. I went to many festivals there. But yeah, nothing but great things to say. I would definitely encourage anyone that's even thinking about it, even just doing one rotation. I think you would get a really great experience and learn a lot.
Thanks, Katie.
Yeah.
So one of the myths is students are concerned with doing rural about making contacts for their letters of recommendation for residency, applying for residency. Did either of you use your rural preceptors for your letters?
Yeah, so I have 4 letters, and 3 out of my 4 letters came from rural preceptors. So yes, I definitely did, especially since like we were saying, like it's just you and the doctor. They get to know you really well. Even like when we did neurology, because that's only 2 weeks at a rural site. I mean, we got to know Dr. Alexander really well. So even just those 2 weeks. So I think that that's really valuable. They can actually speak to who you are, because they know you better than, you know, maybe in Dayton there's other students that are maybe on the team with you. It's just a lot more personal, I think.
Yeah, I definitely agree. I have 4 letters as well, and 2 of the 4 are from rural rotations. And yeah, I totally agree. Just having that one-on-one with the doctor, they can really like focus in on your good aspects and what you need to work on. And I think it's great.
Was there a feeling of isolation? Did you feel maybe disassociated from the medical school at all when you were at the rural site?
I didn't really have any like feelings of isolation when I was there. also, when I was there, most of the time the house was actually pretty full with other rural students. So, including like a couple, like they were second years at the time who were doing, right? Yeah, who were doing AHEC. So you get to kind of work with other students and like hang out with other students who are interested in rural and get to know some people a little bit better, as well as like, I mean, I still connected with my friends through like the didactic sessions, and I mean, I like having like the small town vibe a little bit more probably than some people anyway. So I kind of liked being out in an area that wasn't quite as hectic as Dayton, and being right on the lake is like gorgeous. So I didn't really feel isolated at all.
Yeah, I agree with that. Yeah, Carol and I lived together for many a months with some other students. So yeah, it's really nice the housing because you live with like other medical students. So it's kind of nice they're your classmates or even like the grade below, so you get to like meet other Boonshoft students. But it's also so most didactics they do rurally, but like whenever there was a didactic where we had to go back to Dayton, I just remember everyone was like so excited to see me, and I never felt so loved. Everyone was like, "She's back." I was like, "Yeah, here I am." So no, I didn't feel isolated at all. If anything, I felt more loved.
What about technology and advancements at the rural health systems? Did you feel that they were up to snuff with what you were seeing in Dayton? Um, just kind of up to speed with medical practice?
Like you mean like the EMRs or?
Anything. There's, I think, sometimes a myth that they're backwards at the rural systems and they're not up with technology, and they don't have the 3D mammograms, or they don't have everything that you might see in the city, which I don't think is true. But I don't know if you have any good examples to share, and if you don't, that's okay.
Yeah, I mean, I can share a little bit because one of the days on my family medicine, when the doctor I was working with, she was on vacation or something. So Lori set it up so that I got to go to Grand Lake and kind of just hang out with a bunch of different people and like with radiology. And I got to hang out with a bunch of different doctors, which was a really cool experience. But they gave me a whole tour of the hospital, and it was awesome. Like they did have that 3D mammogram thing, which was really cool. I got to see. And no, I was super impressed. And Mercer Health, like they just redid a whole bunch of things. The whole surgery center's new, which is awesome. Yeah, no, I don't agree with that at all, and not in my experience.
I can't think of like a specific example, but there was not like one time where I was on rotation where I was like, oh, I wish we had this, or they should have had this. Like it's just like working in Dayton. I mean, we had everything we needed. And
Good. How about public health challenges or different social determinants of health in the rural communities? Is there anything that jumps out that you're really glad you got to experience because you think you may not have seen that in the Dayton area?
I will say, like, I felt like obviously with COVID, this was more relevant in my fourth year. But I felt like there was a little bit more education this year in my rotation about COVID and the flu and all that, which I'm sure happens a little bit in Dayton as well. But I felt like I had like really great opportunities to do a little bit like health education, because sometimes the health literacy is a little bit different in the rural area. So I think that's like a cool thing to like hone in on your skills of like teaching and like bringing it down to someone's level to like fully understand like what's going on, especially with COVID, and to be worried or not, how real, is it, what should we be doing kind of thing. So that was an interesting challenge for this year on my rotation.
Yeah, the thing that's coming to mind with me is just that at least in the area I was in, lots of stubborn German farmers. So learning to get them to take medications, when they've been, hard workers all their life. I really enjoyed talking to them so much. And so I think I just learned, I don't know, trying to put in some of those motivational interviewing and trying to sort of convince them that these things they've been doing all their life to, stop smoking that they've been doing all their life, or kind of those things, which I felt like I got way more practice at a rural site rather than being in Dayton. But maybe it could be the other way around. I think it just kind of depends on the patients that come in. But yeah, I felt like I dealt with a lot, especially on my family medicine.
Katie, do you want to talk about the project you did when you were in family medicine?
Yeah, of course. Yeah, that was the other thing too, is so I worked with Dr. McNaughton at Grand Lake, and so she noticed that like a lot of her patients, they drink alcohol, but they like don't want to talk about their alcohol at all. Like they don't feel like it's a problem at all or anything. And so she kind of wanted a way to figure out like how much patients are actually drinking and what their thoughts are kind of on that. So I made a survey to kind of like, you know, it was like alcohol knowledge. So like alcohol can lead to like these diseases, and they were supposed to circle all the different diseases, and this many drinks is binge drinking. And like it was funny to see the results, because some people literally had no idea like what binge drinking is and what kinds of things alcohol can lead to. And then we gave them like a handout from the CDC, and then kind of followed up after we gave them the handout like that said all the alcohol information, whether like that would impact their drinking habits. And most people said neutral, which is fine. Right, not good, not bad, right? We'll take it. But it was a cool project that I did, and I felt like, I don't know, it was helpful in the sense that if we can start to have, maybe people are more open to talking about alcohol, or even putting it on a piece of paper rather than explicitly talking to their doctor about it. So, and even having materials in the office to kind of like have them learn more about that topic, since it was something that they didn't know too much about.
Thank you.
Yeah.
Carolyn, would you talk a little bit about how you set up a fourth year elective that we didn't currently have established based on your experiences your third year, which both of you ended up doing the elective, but Carolyn kind of took the lead with this.
So this elective has served us very well, I will say. So in my third year, I think it was during, my family medicine rotation. I was at Mercer Health working with the winners. And there were a couple days where they either had to leave early or had to like take time off for family. And during that time, I got to spend those days with Dr. Kaur, who's a med peds doc in the same office. And I just really enjoyed like her workflow. I enjoyed the patients she saw, the variety, because she saw kids and adults throughout the day, as well as like the nursery, like some of the other peds docs. And I kind of decided at the end of third year, mostly after spending a lot of time with her, that I wanted to do med peds. So I kind of stayed in touch with her, because she was very like willing to like help me out with my, I guess, career and just really anything. That's another thing to be said, I think, about these rural physicians. They're very accessible and they want to help you. And like everyone's like, here's my number, talk to me about, you know, like what you want to do. We'll help you get there, you know? So that's great. And she was one of those people. So when I kind of solidified that plan, I reached back out to her and was like, hey, I'd really like to work with you again for a whole month and really make it like everything in the hospital, outpatient, nursery. And she was, of course, like super willing to do that. And she kind of helped me set up. It was originally started as like an SIE, which is basically a student initiated elective. And then when I kind of talked to Lori a little bit about it, logistics, we found out Katie would also like to really do it. So Lori helped us like push for it to become like an elective part of our catalog. And we both did the elective kind of recently, and I really loved it. It was clinic most of the day, both adults and kids, as well as we went to the nursery in the morning. We saw like hospital admissions in the afternoon. We went to like a couple like emergency births, like where we weren't sure how baby was doing. So like it was go, go, go. And like as a fourth year, I had like twice the autonomy I did as a third year. And she really like let me, again, take ownership for my people. And because I was there for a whole month, I got to see a couple people back and they knew me well. And it was great. I mean, I loved getting it set up and I'm happy we were able to do it. So Dr. Kaur is awesome.
I agree.
And we should just add, Carolyn referred to the winners, and that's actually their name. There's a husband and wife. They're both Dr. Winner. Not that all the rural docs aren't winners, but specifically is their name.
It sounded weird to say doctor and Dr. Winner, but yeah.
So I think we'll probably wrap up. Do either of you have closing words, something you'd like to share that I haven't given you the opportunity to say about your rural experience?
I did want to just jump in and kind of like reiterate this. I felt that because I did so many rotations and I did them kind of all at once, when I was up there, I really was part of the community, part of the medical community. And like I saw patients in like all of my rotations, like their family members, and took care of everyone. So I would run into someone on surgery in the beginning, and then later I would be like, oh, hey, I remember, and now I'm taking care of their child in pediatrics. So, and I really think that was such an awesome experience of rural medicine because relationships are like a big thing in rural practice. And when you're like immersed in the rural area, like we really got to experience those relationships and take advantage of them. And I felt not only just welcomed from the first moment I was there, but also welcomed into like the like hearts and minds, I guess, of the patients because they knew, hey, she's been here for a while. Like I have had great interactions with her and my family has as well. So I think that's something that's kind of unique to rural medicine that you may not necessarily get in Dayton because there's so many changing of sites, which, has its own benefits, but it's different.
Yeah, I totally agree with that. You definitely are part of the community, and it's funny, like you'll see patients everywhere. I remember one time I was coming out of Kroger and one of the patients was like standing there like smoking a cigarette and he sees me and I wave because I'm all excited and he takes it and like puts it behind his back and he didn't want me to see it. It was so funny. So yeah, you for better or for worse, you're part of the community. But yeah, like I went to church there and so like I would see patients in mass and like wave at them and like that was fun. But I agree, like I felt also like not to say like any of the hospital systems in Dayton like are mean, but like everyone is so nice. They like roll out the welcome mat for you, like at the rural hospitals, because they do get students, but like not as often. And so I don't know, everyone was just really nice and welcoming to me, even if it was like all of the surgery staff, like whenever I was there. And I don't know if I didn't know where something was or if I like didn't know what to do, all the nurses would be like, oh, come on, we'll show you. I don't know. Everyone was really nice, which I think really makes the experience better when you know that, I don't know, you're in a supportive like environment. But yeah, I don't know. Any other questions? But I'm just fired up about rural health. So.
So we have received a couple additional questions, so I'll keep you two on the line. The first one was about surgery, and this brought up a point I should have made earlier. For every clerkship, there's something called a logger, and these are the cases that students need to see. So surgery has a logger, emergency has a logger, and this dictates everything. So whether they're at an urban site or a rural site, as long as they get to their logger, they're meeting the expectations of that clerkship. So for surgery, we have 4-week general experience that's definitely available at the rural sites. But this is a great example. The students have never had any trouble getting through the logger. Occasionally, the only case that comes up is there's not many breast procedures done at some of our rural sites. So what we do in that case is we have the students go back to Dayton, to Miami Valley, spend one day and see the cases that they're not seeing. So I think that was just good to mention that the rural students have to see the same cases that they see at the urban sites. But there's a question about subspecialties for surgery. Katie, I'm remembering you did ENT.
I did, yeah.
Carolyn, I'm blanking. Did you do your subspecialty? You didn't. Okay.
No, I didn't.
Okay. So Katie, why don't you talk about your ENT experience?
Yeah, so I did ENT rural. I think it was the first time that Dr. Vannon had a student, but he was so nice. Oh my goodness, he's just so excited about teaching. And I feel like that also makes a difference in your rotation if you have a preceptor that really wants to teach you. And so I don't know if you guys are traumatized from anatomy yet, but I feel like we spent like 1 second on ENT anatomy. So I felt like it was a really good time to like learn that basically because he didn't mind. He would teach me all of the stuff and I got to see some really cool surgeries. He let me scrub in mostly. I didn't really do too much on ENT surgeries just because, I don't know, they were a lot more intense and it was like always going through the nose, like I couldn't see anything. So like that he could see, for me it just looked like pink stuff on the inside. But so he did a really good job like explaining things to me, but I didn't do too much like where I actually like, I don't know, did surgery like you do on the general surgery. I don't know, you get plenty of that on general surgery, so I didn't feel like I missed out. But ENT was a really good experience, especially since like in ENT, he also sees like adults and kids, which is like obviously what I want to do. So that was nice to see sort of like a whole wide range of patients as well.
So the opportunities in subspecialties will vary depending on the site a student is at. At the Lake campus, we currently have orthopedic surgery through a couple different practices. We have ENT and we have urology. If you went up towards Lima, there would be more opportunities because you have more specialists up there in cardiology and other areas. So that one depends a little bit. There are some of the subspecialties you really should choose Dayton for. So if you have a strong interest in bariatric surgery, transplant surgery, kind of blanking on others, but I have a list that they can offer you in Dayton. And because I get this question every time with students. So I tell them, this is what's at the rural site. This is what's in Dayton. We have no problem with students saying, I want to do one of the Dayton ones, but I'll come up there for the general surgery. That's absolutely fine. We also received a question about rural emergency medicine. So this is very timely, and Katie and Carolyn don't even know this one yet. But just yesterday, we had a meeting with one of our Lima partners, and we're going to do an elective in rural emergency medicine with them. Hopefully get it on the book soon. So we're not doing the clerkship yet. We hope to get to that point, but we're definitely looking at an elective in emergency medicine at our rural sites. I think that'll be a great experience. Neither of you did anything in the emergency room at all. Like, you didn't do a shift or anything like that, did you? No. Okay.
No.
All right. Anything else anyone else wants to add? Carolyn shared that she's applying IMPs, but Katie, I don't know if you mentioned that that's also ironically what you're
Oh yeah,
applying
I'm
to.
also applying IMPs.
And I should say that while a lot of the students that do the rural, especially the rural pathway, the more intense experience, go into primary care. One of our students that's graduating this year is orthopedic surgery, and he was orthopedic surgery all the way, but he still wanted to have the rural experience. We've had a number of students do emergency medicine that did the rural pathway. Those are probably the most common. A lot of IM, family medicine, and peds, though, which is not surprising considering in rural, it's primary care. If we can get specialties, that's great, but we really want to have great primary care in the rural settings and make sure we have a physician workforce there. So thank you, Carolyn. Thank you, Katie. Appreciate your being involved. And I'll just reiterate, if anyone has any questions about rural medicine, please feel free to reach out to Jane and I. And I think I can comfortably say Katie and Carolyn would be happy to do any follow-up questions, as well as other students that have done the rural pathway. We get very nice students doing rural, and a number of them that couldn't participate today told me if they ever could be involved or answer questions, they'd be happy to. So thank you very much for participating today. See y'all.
Yeah, thank you.